Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Maintain a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 147,753 confirmed cases of COVID-19 in Canada and 47,752 cases in Ontario. Chatham-Kent has 366 cases, and Sarnia-Lambton has reported 344 cases. Michigan now has 118,615 cases, with 14,264 cases being in Detroit. Today, we are reporting a total of 2,639 cases of COVID-19 since March, an increase of 3 cases from yesterday. 1 is a worker in the agri-farm sector, and 2 are close contacts of confirmed cases. 2,483 cases are now resolved, and 80 cases are active and being followed by our health unit. 3 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. Parents are encouraged to use the ministry's assessment tool, which can be accessed through our website or ontario.ca. Symptoms of COVID can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, diarrhea. Windsor-Essex has 3 assessment and testing centres, which include St. Clair College Sportsplex, Windsor Regional Hospital OLEP Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to quick access online, you may receive your results before the health unit contacts you. In answer to a question that came up yesterday about the number of tests being completed in our area, our daily 7-day average is more than 700 tests a day. So using this 7-day average, approximately 25% of the test results are available within 1 day, and 2-day turnaround is about 81% of the tests. In the past week, we have seen results taking a bit longer. Please continue to visit our website at wechu.org for further information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us today. With almost 32 million cases globally and inching closer to 1 million deaths worldwide, the COVID-19 pandemic has resulted in societal and economic disruption that this world has not seen before. Every country reacted differently, with some implemented emergency measures to control the spread of virus in the country, while some countries resisted the emergency measures and either reacted too late or even downplayed the risk. Similarly, at the individual level and at the community level, some reacted rationally, while some rejected the idea of taking these strong measures to control the spread of COVID-19. One would wonder why we all reacted differently. If you recall, we talked about mental well-being and the importance of mental health in the pandemic. While it is easier to relate any economic or health impact due to COVID and quantify it, it is very difficult to quantify or relate to any social and mental health impacts of COVID. We all go through the usual cycle of grief or loss by first. In this pandemic, the world has seen a significant loss as a result of COVID. When people go through the cycle of grief, this is what they experience. At first, they experience denial, saying that this is not happening. Once we accept that, we move on to the next stage, which is anger. In this stage, people are hiding many of the emotions and pain, and they are redirecting their anger at other people. Once that stage is passed, people moved on to the next stage, which is bargaining. In this stage, people try to look for ways to regain control by looking at the situations again and try to justify by using statements like, what if I have done this way, or what if others have reacted this way? And once that stage is over, people move on to the next stage of depression, and then finally move on to the next stage of acceptance. And that's where most people should be. And that's what we learn to move on. Not everyone will go through all the stages, and individuals can jump from one stage to another quickly and even miss one of these steps. But the critical piece is we have to accept the reality of this new world with a novel virus that our body do not have any natural immunity against. And despite the great technological advancement, we cannot eliminate this virus completely in the near future. People in our society are going through all of these above stages, and many people are in different stages at this time. And as a result, everyone is reacting differently. While we continue to talk about mental health and mental well-being during this pandemic, it is critically important to go beyond talking and start acting to improve our mental health and mental well-being. The lack of attention on our mental health will result in new challenges in our society. Some of these challenges we have already seen with social media bullying. People who are in denial, people who are angry, people that are still bargaining, and then you have people who have accepted. What is concerning is people who are either in denial and those who are angry. They are attacking others to justify their own beliefs and blaming others for problems that all of us are experiencing. We are in the middle of a pandemic. It is okay to feel that we are powerless against the virus. The virus does not differentiate between rich or poor, or as a matter of fact, any person. Everyone is equally susceptible to it, and we all need to act together, support each other in this difficult time. More specifically, I'm really getting concerned about stigma and bullying locally. During the COVID-19 pandemic, we have seen and heard examples of bullying and discrimination targeted towards a group of people and individuals perpetuating a culture of hate and blame. There is nobody to blame for COVID-19. Some groups that have experienced stigma during this pandemic include healthcare workers, agricultural workers, travelers, and with the opening of schools, children with their families. Stigma, bullying, and violence against others is never acceptable. Everyone is at risk for COVID-19, and every person is capable of spreading the disease. Just like I've said, every resident to do their part to prevent the spread of COVID-19, I'm asking that we all do our part to prevent and stop stigma and bullying associated with COVID-19. Show compassion and kindness. Avoid making negative statements about individuals, groups, or cultures related to COVID-19. For our parents, it is important that you remember that your children are modeling your behavior, and whatever is acceptable for you will be acceptable for your children. Stick to the facts. Do not spread rumors. Get your information from credible sources. And you may wonder that many people are not directly challenging the credible sources as well. So stick to the facts, do not spread rumors, and get your information from credible sources, from scientific experts and scientific bodies. Identify stigma and bullying. Address it, report it, and stop it. Do not be a silent observer. This is a scary time for all of us, especially for our children and youth, and those most vulnerable in our community. Stigma undermines the good work that we are all trying to do to prevent COVID-19 and keep our community healthy and well. We need to support each other. Let's start with our changing language and modeling behavior and working on a culture of compassion and kindness. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Blackburn.
Hi, I just wanted to clarify. Teresa, did you say that test results are starting to take a little bit longer, that you're seeing trends towards that?
This past week, we have seen that the turnaround time to receive the test results is taking a bit longer.
And is that just because there's more tests being done throughout the province?
It could be the lab capacity and the fact that more tests are being completed, but in the capacity of the lab.
So what does that do to your contact tracing? Does it make the process longer?
Well, in some cases, we are waiting for the results, so it does take a little bit longer, but as I, kind of say every day, that those that have been tested and they have a high-risk exposure or they're symptomatic, they're to remain in isolation pending their test results. So the health unit, once we get the result, we are hoping that people have remained in isolation, which is really the protecting others and stopping that transmission if they were to be positive. So if they are adhering to the the testing guidelines, that if you're getting tested and you have symptoms or you've been a high-risk contact or have any high-risk exposure, you're remaining isolated, prior to, anything, going out and about until you receive your test results and hear from the health unit if you're positive.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning. Dr. Ahmed, I'm sure online you've been the target of a lot of bullying and hateful comments. I'm just wondering from your perspective as a person who's experienced that in what you said today, how does it feel to see all of that going on?
Well, as I mentioned, there are some natural reactions that every human being go through. And I think what this world is experiencing, and we have done a lot of work, I guess, from a technological advancement perspective. We've improved our living conditions. We have made rocket ships to go to the space. And for some, it's difficult to understand that how can a tiny virus can disrupt the entire world and then bring the whole world down to its knees. So people are not accepting that fact and then coming up with various reasons, various explanations, and some of the prominent explanation right now, it's all a hoax and there's some kind of conspiracy going on. And what we are seeing is when people hold this idea, and again, no disrespect to them, what is happening is as a result of it, it leads to them expressing their anger, frustration, helplessness to other individuals. And those individuals, some can take it. In my capacity as a medical officer of health, it's my job to do what is right for my community. And I am tasked with this responsibility, and I'll continue to do that. But then there are other individuals who may not be able to take those kind of bullying or stigma or targeting. What we are seeing in the community is even when we are talking about cyberbullying or cyber comments, if someone is trying to talk rationally with some of these individuals, they try to shut them down. And what you're seeing is now is just one prevalent thought, whatever those aggressive people are sharing. And that thought, when it's propagated many times, and these are the same people. And if you read the language, the wordings, these are exactly the same language and wording. Some of it is very much politically driven. They have a political intention. And some are individuals who are also feeling helpless. And they feel that, yeah, they must be right. That's why these messages they continue to see. And this is how our mind works. We like to follow that if someone has said multiple times, it must be true, but it's not. That's why when we're saying the message is stick to the facts, stick to the credible sources, that is where it's important. And people, children especially, and as they are continuing to go to school, they are also, some of them are becoming the target of bullying. And with a lot of things that are happening right now online, it is much more important for parents as well as children themselves to recognize the harms and impacts of bullying, cyberbullying. And if you are a parent, you should be monitoring your child's activity. You should be having this conversation and see what is going on. With many people now have devices on their hands 24/7. What kind of behavior that they are exhibiting, what kind of things that they are learning. So I can totally understand that it can disrupt a society. We have seen many impacts of it. We definitely don't want to see more impact on the mental well-being of our community. And the hope is with this message and with this understanding, people recognize that these are real issues and these are real challenges, and these are all because of COVID. There is no one to blame. There's no one person or no individual, it's their fault that something is spread. COVID-19, it's a virus, it's a pandemic, and we don't have not many tools in our toolbox to contain it other than what we are recommending. So it's time that we all need to come together, we accept some of these things, including the impact on our mental well-being, and take action to improve our mental health and social well-being.
Thank you.
Any questions from CBC?
Yes, good morning. Teresa, just wondering, you said there's a bit of a lag time on the test results coming back. Any idea how many tests are coming back for each day or what that lag time is?
I'm not sure. We're getting actually the positive results. So as you know, I'm reporting today 3 results. So we received those results yesterday. So we are getting positive results as quickly as they're being tested. And we are hearing the odd case where there is a result that we're trying to locate, and we contact the lab and try to track it down. The negative results, we're not getting all of the negative results. We will have access to them. We're working with the lab, and there is a process in place. But we don't have a lab in Windsor. So all of our results that are getting done in our assessment centers, the hospitals, the tests being done in our area are going to the London lab. If they're in London lab is taking tests or swabs from all different health units in the Southwest region. So if there's a capacity issue, those tests then go on to Toronto, and then they also are dispersed to other labs. So it's kind of like as one facility reaches capacity, the overflow must move on. So that's where sometimes there is a lag. I don't know the exact numbers because we're not reporting the negatives. So obviously with 700 tests a day and just a couple positive cases, there are lots of negative tests being completed and online. And also there's a system we use to access tests, and sometimes that's not updated immediately as well. So there's a little bit of lag, but in some cases it has delayed our initial investigation. But anyone, as I said, anyone with symptoms or being told, or if they go online and see that their result before we get it, they should be, if they are positive, they should remain in isolation, and we will reach them.
Thank you, Teresa. Dr. Ahmed, to touch on what you're talking about there with bullying, especially for children and students, as some of these kids go back to school, the ones who have tested positive for COVID-19, has the health unit offered any guidelines or recommendations to schools to help neutralize any, discrimination or bullying these students may face?
Yeah, no, that's a good question, and our team is working on developing some of those guidelines and tools and resources, and maybe even launch a campaign for to address this issue. We recognize that this is something that is ongoing, and there are some areas in the province as well who has experienced that. So I think we have to be respectful, we have to be careful, and what we are setting examples for our children and our community. So it is really important that we recognize that, and many of these tools and resources are currently in the work, and we will share it with the community, and also work with our school boards and the families to provide them with the right resources to help them in this difficult time.
If I may just ask one more question here. What is the protocol for students returning to school after they test positive for COVID-19? Do they get retested once their 14-day quarantine period is over?
Well, no. Right now there is no guidelines to do a negative test before we clear those individuals. The clearance is based on the timeline and the absence of symptoms. whichever is longer. So if typically if a child started exhibiting symptom, let's say on day 3 or day 4 or whenever, so starting 14 days from that timeline, either through the start of their symptoms or when they were tested. So 14 days is the maximum timeline that it needs the body to clear the virus. Most people clear the virus between 8 to 10 days. So 14 days is even a little bit extending to ensure that we are capturing everything. And then all those individuals, if they don't have any symptoms for at least 24 hours right at that 14 days mark, they're allowed to go. And if they have symptoms, that 14 days can be a little longer until they are symptom-free for 24 hours. So that's how we are clearing them. There is no requirement anywhere in this provincial testing guidelines at this time to do a negative, because what we are seeing is these viral shedding, it continues to happen for a much, much longer period of time, sometimes even up to 3 months. And the clearance is of 8 to 10 days, as I mentioned, is again based on the evidence that was done to see if people are shedding the virus, are they truly infectious or not. By 8 to 10 days, majority of them, or 99% of them, are non-infectious. So again, that's why some of these recommendations are changed. But in Ontario, so far, we are using 14 days. Some province in Canada are still using 10 days. US CDC also used 10 days. In the near future, if that recommendation changes, that's a different story. But right now, we're using the 14 days marker to clear anyone, including school children.
Thank you so much.
Any questions from AM 800?
Yes, thank you. Dr. Ahmed, yesterday Education Minister Stephen Lecce said that he's considering shortening the list of COVID symptoms that will require kids to stay home from school. Is this something that you agree with? And if so, what symptoms would you like to possibly see taken off that list?
Well, I think it's difficult to see the growing list of symptoms that are in the checklist, and a lot of my fellow physicians, pediatricians, and family doctors, I think they're also are trying to provide their input in terms of what are some of those symptoms that are commonly expected. So my recommendation to my community earlier on is to have that conversation with your child. The critical piece is this symptom new or expected? So for example, if a child has a history of migraine, let's say, and they often develop headaches, and then if they started exhibiting that symptom, what does it mean? Should that child be excluded? So it has to be a new symptom, which is there is no other explanation or other reason for, any other diagnosis. If it's not there, then yes, it should not. The child should be considered testing or should be isolated until they are cleared. But for someone else, right now it's allergy season and there's runny nose. Should we be including that as a symptom, or and just take it a step further? In addition to runny nose, we know people start to cough, right? Because it's all allergies. And then what does it mean? Should we be excluding all those individuals or limiting their entrance? So a careful review of those symptom list is important, but also I think it has to go back to your child and the history of your child, what is expected and what is not expected. So we'd like to see more clarity, because we want to provide that option to the school boards and also to the families, and make it clear who can attend, who cannot attend, rather than having an exhaustive list, which can potentially mean that every day that there are 10 to 15% of students who are just missing school because they have these symptoms, which may be normal for them at this time of the year. So we would look forward to that, and some of our medical officers of health colleagues from the province are also working directly with the Ministry of Ed to clarify that list, along with some pediatricians and other healthcare provider to clean it up and make it more relevant for children. And we expect to see that coming up shortly.
Okay, yes. So if symptoms such as sore throat, runny nose, and headaches, like you just mentioned, were taken off of that list, would you be in agreement with that?
Well, I guess if it's a new symptom, then yes, we would want these children to see. But I think that's why it's important that anyone, even with like obviously cough, you cannot differentiate like whether it's a COVID-related cough or whether it's an allergic-related cough unless a physician or a healthcare provider have the opportunity to go through the history and the physical assessment of this child to make a decision. So I think it's not as simple as I can say that, yeah, would I agree to that or would I not agree to that? I think we need clear guidance that which starts from, is it something that's new for your child or is it something that you expect to see? And then working through that and then looking at some of the other risk assessment piece. So that's why when you're going through the screening tool, it does touch on many things, not just only on symptoms. So hoping that the tool would be tweaked to provide much clarity in terms of what is the next steps.
Okay, so you're open to the idea, you're just looking for some more clear guidance from the province.
And that is correct, yes.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
CBC?
Yes, one follow-up, Dr. Ahmed. When a student tests positive in a class, why is it that the students of the class must quarantine but not their teacher?
So it's just the way the classroom are structured, and I'll provide my comment, and I'll let Teresa maybe add into more because both of us are involved, and some of these conversations we're having with the school boards all the time. All the children in the classroom, obviously, they're wearing a cloth mask, and then they're having their designated seats and their places, which is there to provide the 2 meters physical distancing as much as possible within the classroom. While the teachers are wearing a different kind of mask. Teachers are wearing a medical grade mask, and some of them also wearing a face shield, and they are maintaining their physical distancing with the student, and even in the classroom that there are designated spots where these teachers are sitting and working. There is very limited reason for us to think that just with all these measures in place that the teacher is at risk of contracting it. The face mask, the face shield, what they're using is pretty much similar to what a healthcare provider is using when they're assessing someone with a confirmed COVID case. And so having said that, we do our risk assessment. By default, these teachers are not excluded unless based on the interview, if we find some reasons to believe that the teacher needs to be excluded. But the majority of the cases, because of all these measures, these teachers are considered at a low risk, and then as a result, they are not excluded, but they are asked to monitor their symptoms. I don't know, Teresa, if you want to add anything more.
That's exactly how it is, and it really is based on the interview with the teacher, and until that interview occurs, we will, assume that the teacher is using the mask and doing the physical distancing, and then we have an interview to actually determine their interactions, what has occurred over the last couple days. So it's really based on the interview to determine if they're deemed a high-risk exposure or a low-risk exposure. High-risk exposure would mean they have to self-isolate. Low risk would be the self-monitoring. So that's the process.
Thank you so much for explaining that.
Any further questions from AM 800?
No, thank you. Have a good day.
You too.
Okay, thank you.